Hi everyone. Welcome to GNN-Off, a non-edited version of the show that I use whenever I don't have access to a MacBook, which is right now. So today we're going to be talking about joint replacements from start to finish, and the joint that I've chosen is the ankle. Now let's go to the diagnosis for ankle surgery. The number one reason for an ankle replacement is usually arthritis, whether it's caused by overuse of the joint, an autoimmune response, or a really bad injury. There are some non-surgical treatments that can be done if patients don't want to go to the operating room, such as exercise and weight loss, mostly because joints can become tight and painful if not regularly exercised, and being overweight can put extra stress on the ankle. It's usually for every 1 pound is 3 pounds of pressure. There's also aquatic therapy because of the buoyancy of water. It can help reduce the impact of injury to the ankle. Assistive devices like canes, walkers, and crutches, and orthotics. Now, for the surgery, a general anesthetic is usually used, but if it's more complicated, like, say, a really bad injury or the autoimmune response, spinal anesthetics could be used as well. The length for the surgery is approximately 6 weeks in total. Obviously, the surgery doesn't take 6 weeks, but the whole recovery period does. And the surgery type can either be done by traditional, where the bone is cut and shaped for the replacement during surgery, almost like a roasted ham, and robotic arm, which is done the same way as traditional, but with a robotic arm assistance, which decreases the chance of loosening, failure, and revision surgery, and it keeps as much healthy bone tissue as possible. It's also more precise. Now, there are some complications to getting a joint replacement, such as loosening, which the replacement itself will start to loosen after a given period of time. Instability, as there is some rehabilitation that needs to be done. Weakness and stiffness. Nerve damage, because they are cutting into tissue. Dislocation, for self-explanatory reasons. Blood vessel damage, and bone break. Now, the cost without insurance is around $40,000 or more. And the time in hospital is usually around 1 or 2 days. They don't want to keep you longer in there because you might actually catch something within the hospital. And recovery, again, is 6 weeks, but full recovery for any joint replacement is usually a year. And the overall chance of a complication is around 1.4%, and that usually happens in adults that are 60, which is who are the patients who are most likely getting a joint replacement. And the lifespan of the replacement is around 10 to 20 years. Thank you for listening. I hope this was informational. This is Grant. I'm signing off.